national conference recently held at Pune, and I was one of the delegate only, and attended this conference, very well managed, and all seniors are here. Along with this, I'm in one photo with Prakash Kothari as well. And what I want to discuss here, whatever so far we decided on a relationship counseling is basic things, and most of the time couple approach us for the divorce or for the interpersonal relationship, or sometimes their parents and everyone comes along with this patient only one, but there are 10 to 15 other people comes along with them, and just they think that doctor will do magic or something so that their relationship become more prominent and they will not go for divorce. Always remember, my dear friend, our institute, after taking various classes, various lectures online, we are in this conclusion that in our case taking, you should have the love mapping. Ask each and everyone along with your history taking, physical examination and everything. Ask them about the first crush. Suppose male said first crush on the female, opposite sex, then it is a straight heterosexual. Otherwise, he may be in gay or homosexuals or bisexuals or transgender. Again, you have to change the diagnosis. Similarly, in the case of female, mostly female are rarely comes to us for this purpose. Anyway, a relationship issue is very important. A relationship role of personality also important. So each and every case during counseling, we are saying you evaluate their personality. Always remember, there are 4 types of personality. Out of that, 2 is inherent personality, that is dominating personality, that is a God-given personality. You can't change the nature of the dominating personality. And the weak personality, you can improve very well to the strength. So you have to find out the strength of each and every personality. Suppose any client reach to your OPD, always find out whether is a what is the number of or highest number of the powerful personality, perfect personality, peaceful, or popular personality, whatever. And then once you find out the personality evaluation, then you can treat them very well. You can understand what is the weakness of the person. Once you know the weakness of the person, or male, you have to find out the weakness of the female part as well. And then you have to match there. Mismatching, you have to make them matching. Means you balancing the personality. That program I already completed each and everyone. Again, during hands-on training program, we are taking special class on this for half hour, and everyone has to do the examination on that personality evaluation and what type of guidance you will do during counseling. Relationship is a major issue. Everyone wants 100%. Expectation is more here, 100% expectation of the male part or female part, that causing them, leading to the frustration. expecting nobody's 100%, maybe 50-50%. You have to manage it. Remaining parts means, suppose their personalities, dominating personalities too powerful and popular, then peaceful and perfect is less, then you have to increase the peaceful meditation and other thing and perfectness in that individual, and the individual personality will match each other and they will be happily remain together in future. This is the way whatever, when one person is talking, then another person should have hearing. Because we lost the hearing part, we never hear anyone. We start action. Always we are just like action mode. So don't take action. Just if you really want to keep your happy married life, then you must have silent personality. Like once, if one is saying something, other just to do the action about hearing. If you are not want to hear, still hear. Then when you start the acting, ask your partner, now my time, you have to hear it. This is the way you can go to the proper conclusion. Most of the time, both the partners are right according to their personality. But their personalities differ. If the personalities differ, then their partner feel that is not up to my mark, is not of my mentality, my wavelength is not matching. This is the way what patient complain to us during counseling and interpersonal relationship. My dear friend, so you must be a problem that leading to problem in sexual intimacy. Play performance anxiety arises because of the fear and confusion, and dysfunction started like erectile dysfunction, premature ejaculation, low libido, like problem arises. What to do for this? Working self, working others part, both the part and all. Intellectual, emotional, and sexual part is a marital work, is energy gaining, and practical is energy training when they perform intercourse. Now, my dear friend, here in this slide, these are vague slides we are collected, we are using for just discussion. Here, gender identity, once you ask for crush, if the first crush at the age of 10, 12, sometime 13, 14, adult, adulthood stage, adolescent stage, then it may be crush to the opposite sex, then is the straight heterosexual. Same sex crush, then it may be problematic, may be gay, then rule out other factors, bisexuals and transgender and so on. Fenugreek improves in this conference. We are suggesting fenugreek for the male is increased testosterone, but they suggested it is also help for female part also. Mostly female we are using soybean in our clinic. L-citrulline is added to the arginine as what you call is a boost up, mind booster or sexual boost up. The watermelon is contained with arginine, L-citrulline is added. You can try that also. But most of the time we advise them watermelon, garlic, and almonds, dark chocolate, and so on to improve their mind boost up for sexual act, improve their libido. According to Master and Johnson, censored focus foreplay methods. First stage, first 2-3 days, partners touch each other one by one, whole body but not genitals. After 3-4 days, partner touch each other one by one, whole body, including genitals. After this week, mutual touching, stage 3. Then stage 4, engagement in sexual intercourse. This is step by step, censored focus, foreplay methods described by great sexologists Master and Johnson. Before 1960, before Master and Johnson's, everyone feels that male are active, female are passive. Master Johnson proved that both are equal desire, equally active, male and female, and both need, just like a food, sex is also food for them. Then sexual dysfunction in female, mostly vaginismus, is very common, unconsummation. They are married but can't is an issue of fertility. Find out it is a organic cause. Then dyspareunia, maybe due to the bacterial, maybe fungal, or maybe any disease, maybe any tumor, anything surrounding that. If vagina, near about vaginal muscles and all. If there is nothing like disease and all, then mostly it is psychogenic. That is called vaginismus. Inadequate, even sometimes inadequate stimulation is there. Your partner, you ask male part to stimulate her clitoral stimulation is very, very important factor you have to add to your client. You do that also instead of thinking about to do the vaginal intercourse. But vagina is nothing but it is just like a collapsible tube passing the semen for fertility point of view. But real organ, sex orgasmic organ in the female is clitoris. You can also explain in different way, like when the baby in the womb of mother during embryonic stage up to 2.5 months, all the organs develop except sex organs. If it is a tube-like, then baby become a male baby. That is a penis is the male orgasmic organ, and female is clitoris. Because this phallus of ectoderm become either clitoris in the female or penis in the male. So most of the role of orgasmic sexual orgasm is clitoris. So clitoris stimulation is very important. And penis size is not matter. Even 2.5 inch penis can satisfy any vaginal intercourse, any lady in the world. It must be remained longer time. That is very important. Lifestyle modifications slide. This is a vague slide so that you have to interlink the things together, because this is a vague collection. Whenever my 8 to 12, 13 students was there, they collected the pics and they sent to me, and I just make one. Someone asked me, why not, sir, you take one class on what's happened, what's new in this conference. Lifestyle modification is very important. And nowadays, I have seen even simply reducing my weight 10 to 12 kg, reduce my totally reversible of my blood pressure. That was the last 5 to 6 years. I had blood pressure. I had to take, now it become a low blood pressure. I had to increase the blood pressure tablet every time once reduce the weight. Similarly, my HbA1c was in diabetes is a 9.5. Now recently was 6.1. I am now pre-diabetic condition. Now gradually I'm going to reduce my medicine. If I'm remaining free from any medicine more than 1 year, then it is a reversible in my diabetic reversible program and blood pressure reversible program. So, my dear friend, is always remind that if there are two truck capacity is one truck capacity is only 50 quintal. If you add on 100 quintal, what will happen? That truck will damage soon, and anything will happen, will fail. The same is our body is just like a God given machine, and that machine, if you have extra weight uploaded, then what will happen? Same things. The lifestyle modification is a major role in preventive health care. Now, orgasmic diet, all vitamin D, vitamin B12, and arginine and other things, trace element and zinc, selenium, all are effective role on this. Yeah, and just remember, male get erection just like a bulb. Bulb, you switch on the bulb, get the erection, and you stop the switch the again, stop the button, then it's closed down. The male get erection faster and lose faster, ejaculate and lose faster. Female is just like an iron. I like these things very well in this conference. This iron goes when he's on electric, it goes slowly and slowly is increasing heat level of the iron. And gradually when it stops the switch, then it's cool down slowly and steadily. The sexual life cycle, if we study for the male and female, is just like a bulb and iron. So male get erection very faster, ejaculation, orgasm zero. In female get desire is there, but instead of erection, female get more and more secretion and orgasmic and movement of the muscles and periphery, vaginal and all, and pelvic flux and all. And these are again, they need more and more time to cool down. After sex, your partner should remain in touch with the female part. Just like iron need the time to cool down. That is one great message I learned from this slide. The sign of stress is very, very important, my dear. And there are many signs appear on the body and mind. The root cause of each and every disease mind is called Adi. When it is precipitated on your physical body is called Vedi. These signs and symptoms differ from individual to individual. Some are showing the mental signs, some are emotional signs, some have physical sign, problem, behavioral sign. You have to find out what the mental sign. What is psychological stressor? Minor stressor, major stressor. Minor stressor include crowd, daily routine, busy, hectic life, traffic jam, financial and family problem, various exam, admission of the kids, etc., job stress. Major stressor, marital discord, divorce, various illness of self, family members, friends, legal cases, death of someone near and dear, disturb interpersonal relationship, sudden change in social, cultural, and emotional status, sudden loss of job, etc. What are the physical signs during the stress? Dizziness, some get body ache and pain, grinding of teeth, clean jaw, headache, indigestion, insomnia, palpitation, tinnitus, tremors, change in weight. Mental sign, constant worry, forgetfulness, unable to take decision, lack of concentration, loss of sense of humor, poor memory, etc. Mental signs. Emotional signs: anger, anxiety, depression, cry, feeling of loneliness, frequently changing the mood, irritability, negative thinking, nervousness, sadness. Sometimes you may realize that why your partner is crying because there is emotional sign. My dear, you have to take care. Your emotional, because male are more less emotional, female are more emotional. So you have to care the female partner. Female is like, you can say, flower, gulab. Be very, very thing. Just you touch, handle it carefully. Otherwise, it's separated like flowers separate in the petals will in the same way our emotional signs. Control your anger. Behavioral signs: frequent change in job, increased use of alcohol, explosive speech and action, compulsive eating, withdrawal relationship from society, mental state, and so on. This is sexually will, where sexuality is based on your body, thoughts of feeling, gender, relationship, values, and beliefs. Emotional intimacy is a very important factor. Sexual stimulation and sexual arousal and sexual desires. Emotional and physical satisfaction is very important. Common intimacy disorder: love addiction, love avoidance, sex addiction, internet sex addiction, pornography addiction, sexual trauma, sexual compulsion, sexual anorexia. Penile rehabilitation, lifestyle modification, story of S. S for soup, salad, sex, swimming, stress, sleep, smoking, spirit, sweet. So swimming, up to swimming, soup, salad, sex, swimming is important for your better life. Stress, sleep, smoking, spirit, sweets, you have to avoid from your life. Healthy lifestyle, healthy sexual life. Sleep should be balanced sleep, minimum 7 to 8 hours sleep. If you are not getting sleep properly, means you are going in future problem of blood pressure or diabetes or any stress related problem. Stress management exercises very important role. Happiness is very important things. The role of dopamine is eating food, achieving goal, complete tasks, self-care activities, dopamine increase. Oxytocin, low hormones, socializing, physical touch, feeding animal, helping others. Serotonin, sun exposure, mindfulness, be with nature, meditation. Endorphin is a painkiller, relieving pain, and endorphin, whenever you prick the needle, acupuncture, they say there is an endorphin mechanism and the pain is reduced after the needling. Mind, sex, yoga is correlated according to one paper presentation. And you must give 1 hour in a day for at least Surya Namaskar, various poses, 12 poses. Then these are the asanas also helping a sexual life, pelvic floor exercises mostly, energizes the digestive, excretory, and reproductive system, tone of developer of pelvis, actually, moon pose, the Ardha Machandras, these lotus, these asanas, Vajrasana and all. You just attend class, everyone knows. If you're not knowing, join any gym with yoga. teacher so that you can understand the things. At least you start yourself so you become younger and fix, better for increasing sexual stamina, better for increasing hardness of penis, better for increasing pelvic floor muscle tone. Halasana, Dhanurasana, these are all helping them. Majrasan, cat pose, Manjriasan, Sirsasan, Pranayam, Prana, alternate nostril breathing, Anulom Vilom. Yogic breathing exercise, very important. Ujjayi pranayam you can do, even by sitting here, hearing lecture, you can do it. Ujjayi. Inhalation and exhaling, control inhalation and exhaling. Slowly inhaling and slowly exhaling. Try to do it and see the effect after a week, after a month, after this. This gradually, Kapalbhati, if we give the stroke to your abdomen, will reduce 1 gram. One stroke leading to 1 gram. We will say 10 stroke will reduce 1 gram. Suppose you have to reduce 100 grams, then you have to do 1000 strokes. 100 gram will be reduced. Kapalbhati. Brahmari, that is mental stress and strain remover, that give the mental tranquilizing effect on the brain and mind is proved techniques and methods. Brahmari. That is um, um, and so on. Yogic breathing exercise. Conclusion. Stable mind is important for stable sex. Mind, healthy sex means healthy health, healthy heart, healthy respiration, healthy everything, kidney and all. If all major organs are working good, means you are sexually good. Now, module 2 we will take next time, and we now here uh, we conclude and we will meet again after next Saturday. There are a number of slides so that you will remain in touch and you will come and attend more and more. I will try my best to give you 100%